Okay, everybody. I'm here to introduce myself, Fiona, and my colleagues Benny and Catherine to talk about Ireland's physical activity research collaboration, which has been really, really useful and instrumental in terms of supporting the research background and the evidence base behind national policies such as the National Physical Activity Plan and the National Sports Policy. Next slide, please. So to give you a reason as to why we need to promote physical activity, here we have some data from the Healthy Ireland survey. And this is also tracked by the Irish Sports Monitor and in children by the Children's Sport and Physical Activity study. But basically, what the problem is that we have national physical activity guidelines, and if you're meeting them, generally the evidence is that you are actually active enough to maintain your health. If not, that's more questionable. As you can see from these data, the levels of activity go down with age. So for 15 to 24-year-olds, we have 61% that are meeting the adult guidelines, which are 30 minutes a day, 5 days a week. But this goes down to 18% at 75 plus, and there's a fairly steady decline over the age range. For children, these data aren't shown, but CISPA is showing us that basically only 13% of school-age children are achieving the children's guidelines, which is 1 hour a day, 7 days a week of moderate vigorous physical activity. And basically the policies we currently manage are trying to boost the levels of activity. This is really important because not only are we aware that physical activity prevents chronic disease, but recently through the COVID-19 pandemic, we have found that it offers significant protection against severe outcomes from COVID-19 as well. Next slide, please. So the national policies that we have that support increased population physical activity, starting with the National Physical Activity Plan, which was launched in 2016, and that aims to get 1% per annum of the population meeting the physical activity guidelines every year. The National Sports Policy was launched in 2018, and that supports a 10-year plan for increasing population activity up to 60% of the population in 2027, meeting the physical activity guidelines. Each of the policies has a vision and targets and multiple sectors involved. Health can't do it alone, sport can't do it alone. So we've involved other government departments such as education, housing and planning, rural development, transport and various others in taking a look at how we can enhance the ability of people to be more physically active by improving the environment for that, by improving the school curricula. We should note that education has recently brought in a well-being curriculum for the junior cert and has brought in senior cycle PE and leaving cert PE as well. So there have been a lot of developments in various sectors, and there have been attempts to link all of these policies together in a coordinated fashion so that health and well-being is basically a part of most policies that are relevant to it. Next slide, please. The challenge, however, is that we've a lot of very good organizations that are running a lot of interventions in the sports and physical activity areas, and also in terms of transport, tourism, and all the rest of it. But without a coordinating mechanism, the impact of those individual interventions is possibly less than it would be if it were coordinated and if we could build on our achievements. So the aim behind IPARC is to have effective interventions, effective implementation and coordination, and enabling contexts to increase the population's physical activity levels. Next slide, please. So just to give you the vision of IPARC, it fosters insight, intelligence, and innovation to enable more people in Ireland to be more active more often. And it provides a very valuable evidence base and research behind the policies that we implement. It involves multiple stakeholders across policy, practice, and research, and these work together to identify the gaps on how to develop and deliver best practices and seek ways to bridge them, to support solutions to increase physical activity, and to share learnings from research and best practice in a way that involves not just the policymakers, but the practitioners and the researchers, and to make this systematic and easily accessible and the ground can use this. And then also we've been establishing mechanisms for demonstrating the impact of IPARC and have been running a very successful annual conference, first in person, but after the pandemic online, that has really been very helpful in terms of informing more people about the value of staying active. And I'm going to hand over to Catherine now.
Thank you very much, Fiona. And I'm going to just go on now from Fiona. And what is the collaboration about? Well, the Irish Physical Activity Research Collaboration started by bringing together 3 government departments, 5 state agencies and 6 research institutions, very much bridging the gap between research, practice and policy. And over the last 30 odd months that we've been working on iPark, we have developed a practitioner advisory group, which includes representatives from 24 different organisations tasked with the promotion of physical activity, either directly or indirectly, and a research advisory panel made up of experts in the area of physical activity for health nationally, but also from 4 international countries. And I'll come back to our Twitter account, but we developed a Twitter account, we developed a website and so on, and I'll come back to that in the next slide. So next slide, please. So Fiona's already presented the iPark formula, and the iPark formula is based on the National Implementation Research Network. And it basically says that the relationship between interventions, the implementation of those interventions, and the context that makes both the implementation and the development of interventions available is multiplicative as opposed to additive. In other words, it has an exponential effect if you combine effective interventions with effective implementation strategies and place them within an enabling context. That is one of the ways that can lead to socially significant change. And in iPark's respect, this is increased populations levels of physical activity. Fiona has touched on the enabling context, but let me come back to effective interventions. And Benny will give you a practical example of this in a little while. But effective interventions, what we did was we looked at the evidence base around pragmatic evaluation of interventions on the ground. And from this, we developed a toolkit that is about building capacity among practitioners and policymakers and researchers in relation to how to use evaluation methodologies to determine the effectiveness of your interventions. We then that's one toolkit, and this is ready and we've begun disseminating that. Our next toolkit is the effective implementation toolkit, and we're finishing this one off at the moment. But essentially what we did, again, we went to the literature, we published a systematic literature review in this area, and we went out and spoke to 10 different physical activity interventions that are run across population levels, children, adults, older adults, clinical populations, different types of interventions. And we asked individuals who were running these interventions, who were funding these interventions, who were taking part in these interventions, what made them effective in terms of their implementation strategies. And from that, we've come up with barriers and facilitators and converted that into our second iPark toolkit. And the final iPark toolkit that we developed was as a result of working on effective interventions and effective implementations. We were asked lots of questions from policymakers in relation to how would we embed this in practice in an ongoing basis. And that really requires the different intersectoral groups, be you a planner, a transport engineer, a sports coach, all of the different sectors, understanding that really when it comes to addressing physical inactivity at a population level, you need a systems-based approach. You need to approach it from all of the different partnership groups in a collaborative way to really impact on positive change. So our final toolkit is on a systems-based approach to physical activity and how you work to promoting that. And I'll hand over now to Benny. Thank you.
Thanks a lot, Catherine and Fiona. So what I'd like to do next is to just highlight some of the practical applications of the work that we've done with iPark in Sport Ireland. Just to begin, maybe like many of the agencies here, we would have traditionally commissioned large evaluations of many of our investments to understand what was working and what investments were most successful. As valuable as those evaluations are, they can often be slow and somewhat expensive. Often the feedback can take 6 to 12 months to get from an initial tendering to by the time we get a report into the hands of practitioners. Sometimes the feedback can be a bit cumbersome, can almost feel a little bit generic at times. And these evaluations, because they're often isolated bodies of work, they seem to struggle to measure success objectively, because they struggle with comparative analysis to perhaps other evaluations. We also found that often by the time we get the report out there, staff may have moved on. And we'd wonder who's reading these reports and who's really embodying the feedback to then change practice on the ground. I might use a quick analogy. Obviously, coming from Sport Ireland, we do a lot of work with athletes. If we were trying to improve athletic performance, we'd never work on that basis. You can't imagine giving an athlete feedback 6 or 12 months after a particular action. And indeed, the format of the feedback wouldn't be in a 50-page report, and certainly it wouldn't be about another athlete or about athletes in general. It'd have to be specific to that athlete. So working with IPARC, we believe that the evaluation toolkit provides us something that's much more fit for purpose. Using the content of the toolkit and the measures that are suggested and the strategies that are suggested, we in Sport Ireland have built what we're calling kind of an evaluation dashboard. This is something that is much faster. It provides really fast, down the line, probably almost instant feedback for both practitioners, policymakers, and researchers. It provides specific outcome-based feedback, and it can be drilled down to specifically about you, be you a practitioner, a development officer, or a policymaker, or a program developer. But at the same time, it also gives you information about everybody. So you can compare and see how your initiatives are working relative to other initiatives, and tweak and improve and change your practice, and then go and see whether that practice improves the ultimate outcome. I'll give you a quick talk through the dashboard that's here up on screen at the moment. To date, we've rolled out these measures with about 20 organizations. 17 of them are reported in this dashboard. What you can see here is that we've rolled out the measurements across 119 initiatives, which span 20 different sports. And just under 6,500 people took part in those initiatives. We collect our data at 3 time points. At registration, so before somebody engages with our initiative, that gives us a baseline measure. After the initiative has finished, and 3 months after the initiative has finished, so we can get some kind of sense of whether there's any sustainability to any changes. The prominent measure that we use is reported activity in the last 7 days. And so we ask people how many days in the last 7 days have they been active. They give an answer anywhere between 0 and 7. So in the gray area, you have people who say between 0 and 1. In the light green, you have people who report 2 to 4 days of activity. And in the dark green, 5+ days of activity, which is the National Activity Guidelines. And really our objective in physical activity interventions or sports participation interventions to move people from this top left-hand corner of inactivity as they move through from post 3-month follow-up to try and shift down to increase this dark green bar on the bottom right. And so what you can see is that our initiatives, this whole in general are quite effective. We see inactivity reducing even to 3-month follow-up, and we see people who are meeting the National Physical Activity Guidelines also increase. The beauty of this is we get large generic feedback, but it can also be drilled down. So down the right-hand side, you'll see there's a map that lets us to go to specific locations. We can drill down by the initiative type here, just moving slightly to the left. We can also drill down by different age groups. We can filter by age groups to see if some initiatives are more effective with certain age groups, and we can also drill down by gender. And up the top right-hand side here, we have a number of filters which allow us to filter the data even further. So the beauty of this is that it puts the analysis into the hands of the practitioner and gives them fast, rapid, outcome-focused feedback that they can use on site, but also that we can use in Sport Ireland and that even the department can use in terms of deciding where our investment. Hopefully that gives you an idea of some of the practical applications of what these IPARC toolkits can provide. Just to kind of finish up, a quick summary of what has been achieved by IPARC to date. It's been a 32-month project. Due to COVID-19, we had an 8-month extension to the project. The IPARC presented at 7 international conferences over the 32-month period. It hosted 2 expert symposia and 2 national conferences here in Ireland. One which was held in person and one which was held virtually due to COVID-19. The IPARC project has a website, a Twitter account with over 1,000 followers, and 600 members who are registered on the website for IPARC updates. To date, IPARC has developed 3 toolkits and hosted 1 toolkit workshop to help train other sectors and other agencies in using those toolkits. And indeed, if there's anybody today who's interested in possibly accessing some of those workshops or learning more about the toolkits, please don't hesitate to reach out. IPARC has 1 research advisory panel, which Fiona mentioned earlier on, or was Catherine that mentioned the research advisory panel earlier on. And indeed, we're constantly looking to expand and hear from new experts in the field. So again, if people are interested in being involved, please don't hesitate to reach out. And we've also got a practitioner advisor. To date, IPARC has worked on publishing 4 journal articles, 1 on systematic literature review, 1 on a systems approach for physical activity in Ireland, 1 on a standard evaluation framework, and 1 on effective implementation. From my end, I must say, great thanks to my colleagues, Catherine, Fiona, and Ciara, who are on our call today, but also all the members of IPARC. It's been a really enjoyable experience in collaborating and sharing ideas, sharing knowledge, and lots of really great memories. So just to wrap up, a big thank you to all our funders, our collaborators, and our colleagues who worked with us on this project, especially to our colleagues in Healthy Ireland, who've been key funders of this project, and indeed the HRB as well, and also to my own colleagues in Sport Ireland for their continued support of this project, and our own Department of Tourism, Culture, Arts, Gaeltacht, Sport and Media. Full list of partners there on the last slide. Great thanks to all of them, and we look forward to your questions. Thank you.